I'm Dr. Dilpreet Brar. I work as a founder and MD with MedECube Healthcare, which has a parent office in Singapore and headquarters in Gurgaon. I worked as a doctor for 15 years and then worked with Max Healthcare as an executive director and Fortis as a regional director, altogether for another 15 years. That's been my journey so far. So MedECube is a venture which is aimed at being an assetless healthcare company, which forms an aggregation layer above existing hospitals. So basically it works with patients to make healthcare hassle-free for them. So the go in between the patient and the doctor. So we thought about it and we realized that the patients and the doctors have about 6 problems. Number 1 is discovery. Who to go to, which hospital, which doctor, who to go to in case of any problem. So that's discovery. The second problem is access. How to get to that doctor, how to get an appointment, how to get to the hospital system, how to get to that place. So that's access. Once you do that, then where are your records? In what form are they? Are they in a form which is well understood by both the patient and the doctor? Do they have trend lines? Are they in a proper format or not? Then after you've taken an opinion, a lot of times you need a second opinion. And second opinion across the world from some of the world's best hospitals, Mayo, Cleveland, Stanford, etc. And of course, the best hospitals in the domestic field as well. So second opinion is the 4th problem. The 5th problem is navigation. Once you reach a hospital, how do you navigate a complex system? You get a consult done, then they send you for radiology, then you got to go to pathology. It's a complex healthcare system. So we help patients navigate the system. Then the last problem is coordination. A lot of times there are more than one doctor involved in a treatment. So how do those doctors talk to each other? Who connects all the dots so that the way forward for the patient becomes very simple? So the patient understands it better and the doctors end up talking to each other and putting everything together and coordinating the whole thing. So that's the pain points that we address, the problems that we address both for patients and the doctors. So the patient benefits, number 1, because these problems get easier for the patient to handle. The doctor benefits because the doctor has to spend less time doing non-clinical work with the patient. So we coordinate and do all the non-clinical work. The hospitals benefit not only because we create a line of patients for them, both from the domestic as well as the international segment, but otherwise we make their whole journey better. So the hospital ends up giving a better service to the patients. So all 3 benefit. There are lots of people doing similar stuff, but in bits and pieces. There is no one I know of who provides end-to-end healthcare experience. So you can outsource your entire healthcare needs to us, whether that's OPD or IPD, or once a patient goes back home, it may be medical equipment, it may be nursing, it may be GDA, it may be an ambulance in an emergency, it could be preventive health, it could be anything. So we say that we provide end-to-end healthcare solutions. That's one way. The second way is that our employees are doctors. We are a company run by doctors. So there are doctors whose expertise we use. Very importantly, we intend as you see our logo, it stands for 3 E's, which is ethics, empathy and expertise. So we have doctors who feel for the patient, so there's empathy, and very importantly, we want to do it in an ethical manner. That's how we are different from some of our people in the atmosphere. But hospitals do a lot of this also. So how are we different from that? So one patient may need more than one hospital for its treatment. He may need another hospital in India, another diagnostic lab, a hospital overseas. So we have neutrality and we are above the hospitals creating an aggregation. So we are able to give the patient best in a combination. So that's why we're better than any one hospital group. So our funding partner is Artiman Ventures. It's a Silicon Valley based company which has given us 25 crores of rupees to start funding in. The working model is a combination of low touch and high touch. So high touch means we have a lot of people who have a lot of expertise, doctors and other people who help make it easier for the patient. So that's the high touch model. Then a part of our model, very important part actually, is a low touch model, which is the high-end software technology. So we are creating a very, very significant investment in software, which is going to make it easier for the patient, whether it's website or an app or access to records, etc. It will make it easy. Very importantly, because of our funding partner, we have a lot of exclusive access to high-end innovative healthcare technology in the US and Europe. which gives us exclusive access to new innovations in the healthcare industry, which we can create awareness for not only for the patients but for our doctor partners also. In the current scenario, number one, no hospital group has complete EMR solution in order, right? We intend to give a complete EMR solution, but more importantly, like I continue to say, we are an aggregation layer. So whether a patient sees one doctor in one place, gets a diagnostic from another place, or gets the same diagnostic from 2-3 different places, we will input all those records into our system so that that's all available at one place, and not just available at one place but easy access. So the patient will be able to see the trend line. Let me give you an example. Let's say a patient is a diabetic and gets a sugar done from an X diagnostic lab, and then after 1 month from another diagnostic lab, third time in a hospital, and then another hospital. So how do you create a trend line? How does the patient know which way his sugar is going? Does he need to get another test? So not only will it create a trend line for the patient and put it all together, but it will also help giving alerts to the patient. When does he need to get his next sugar done? Once we put that in place, and we also put medication record in the same place, it can also give medication alerts to the patient, when to take the next medicine, which becomes extremely important for our geriatric population. Older men and women tend to forget when to take the next medicine. So it will give alerts and reminders to everyone. And extremely importantly, the app can be accessed by your children living in some other country. They can see how the vitals of the parents are, how the tests are going on, whether the parents are taking the medicines or not even. So the record system will be very elaborate and very comprehensive. So right now our parent company is in Singapore, and we've set up a headquarters in Gurgaon. In the next couple of months we intend to set up offices in Bangalore and Mumbai within India. We have already identified partners in Iraq, Afghanistan and Africa, where we will be setting up our next few offices. So in the next 7-8 months we should have 7-8 offices. But very importantly, in about 6 months from now, we intend to go into the developed world. So whether it's the US or UK or China, Australia and parts of Europe, we intend to create a cost arbitrage model across the world, and we will even get the developed world to start coming into India for their healthcare needs. Let's say different countries have different needs, right? Right now we get Chinese patients coming to India for a hepatitis C problem, let's say. But as that starts happening, and if you have an office there, you can educate the people and create awareness that India is not only for one disease, India can handle other stuff. So we'll start getting patients from China for that. If you look at UK, there is a very strong healthcare system with the NHS, but there is a lot of long waiting time. So we intend to address the waiting time problem and get patients who don't want to wait that long for elective surgeries to come to India. If you look at the US, unlike what people tend to feel, there is still a very high number of people who are underinsured or not insured, right? We intend to get to them. Very importantly, we also intend to get to the insured population who want to get something done which is not covered by insurance. For example, a cosmetic surgery, for example, a bariatric surgery. To give you an example, we've had 3 patients coming from Canada in the last month where they wanted to get, let's say, an angiography done, because out there the healthcare system is so particular and the protocols are so fixed that an investigation cannot be done because the patient wants it. If the ECG is normal, the doctor won't get an angiography done. But the patient in this case was a little scared because both parents had a cardiac disease. So he wanted to get an angiography done, and the doctors in India felt it was reason enough to do an angiography. We did an angiography, and lo and behold, he had a blockade. He went back and got stenting done in Canada, but the preliminary investigation was done in India because the Canadian doctors originally refused to do it for him.